Hey everyone, and welcome back to the channel. Today we're tackling a very serious and important topic, alcohol poisoning. We've all heard the term, but do you really know what it is, what the signs are, and most importantly, what to do if you suspect someone is experiencing it? Stick with me, because this information could literally save a life. So, what exactly is alcohol poisoning? In simple terms, it's an overdose. It happens when there's so much alcohol in your bloodstream that it starts shutting down the life-supporting areas of your brain. We're talking about the parts that control your breathing, your heart rate, and your body temperature. This isn't just about being too drunk. It's a life-threatening medical emergency that needs immediate attention. This usually happens when a person consumes a huge amount of alcohol in a very short period. This is often called binge drinking. And it's not just from beer, wine, or liquor. It can also happen from ingesting non-beverage products that contain ethanol, like some mouthwashes, colognes, or even cough medicines. The key takeaway here is speed and quantity. Your liver is amazing at its job of filtering toxins like alcohol, but it can only work so fast. When you flood your system, your liver gets overwhelmed. The excess alcohol then acts as a depressant, slowing down all your body's critical functions. If you think someone has alcohol poisoning, don't wait. Get them medical help immediately. Knowing the symptoms is crucial. Someone with alcohol poisoning might be extremely confused and have very slow responses. They might not be able to walk or will lack coordination. A major red flag is difficulty staying conscious or passing out and being unable to be woken up. Vomiting is common, but what's really dangerous is a delayed or absent gag reflex. This means they could choke on their own vomit, which can be fatal. Other critical signs to watch for include slow or irregular breathing. That's fewer than 8 breaths per minute. Their heart rate might be very slow. Their skin could feel cold and clammy, or even look bluish, especially around the lips and fingernails. This is a sign of hypothermia or low body temperature. In severe cases, they might have seizures or lose control of their bladder or bowels. And of course, they will likely smell strongly of alcohol. If you see these signs, you need to act fast. So, what should you do if you see someone who might have alcohol poisoning? The most important first step is to seek help. Call your local emergency services immediately. Don't assume they'll just sleep it off. While you wait for help to arrive, stay with the person. Try to keep them awake and sitting up. If they are conscious and can swallow, you can encourage them to sip water to stay hydrated. But never ever try to give food or drink to someone who is unconscious. They could easily choke. If they are unconscious, the best thing you can do is gently turn them onto their side, with one knee bent to support them. This is called the recovery position. It helps keep their airway open and prevents them from choking if they vomit. Alcohol poisoning can cause a dangerous drop in body temperature, so cover them with a blanket or a jacket to keep them warm. As you do all this, talk to them. Let them know who you are and what you're doing. This can help prevent them from becoming agitated or belligerent out of confusion. When the paramedics arrive, be ready to tell them everything you know, what the person drank, how much, and over what period of time. Every detail helps. Let's break down how alcohol affects your body. When you drink, alcohol is absorbed into your bloodstream, and your blood alcohol content, or BAC, starts to rise. At a BAC of 0.02%, you might feel a little relaxed. At 0.05%, you start to feel uninhibited, but your judgment is already impaired. The legal driving limit in many places is 0.08%. At this point, your muscle coordination is reduced. At 0.10%, you'll likely have slurred speech and slowed thinking. By 0.15%, you're probably nauseous and have lost your balance. Once you get into the 0.15% to 0.30% range, you're in a state of confusion, drowsiness, and are likely vomiting. This is a serious danger zone. A BAC between 0.30% and 0.40% is considered alcohol poisoning, and you'll likely lose consciousness. Anything over 0.40% is potentially fatal. At this level, you're at high risk of a coma and death from respiratory arrest, which means your breathing stops completely. There's no magic number for how much you can drink before reaching these dangerous levels. It's different for every single person. Several factors increase the risk of alcohol poisoning. The biggest one, as we've mentioned, is binge drinking. This is defined as a pattern of drinking that brings your BAC to 0.08% or higher, which for women is typically after 4 drinks in 2 hours, and for men 5 drinks. Another huge risk factor is mixing alcohol with medications, especially opioids, sleeping pills, or even over-the-counter antihistamines. These substances are also depressants, so when you combine them with alcohol, you're magnifying the effect dramatically. Drinking on an empty stomach is also a major risk. Food in your stomach slows down the absorption of alcohol. Without food, alcohol passes into your small intestine much faster, causing your BAC to spike rapidly. Your age can also be a factor. Teenagers and young adults are often more likely to engage in binge drinking. Interestingly, statistics show that about 75% of people who die from alcohol poisoning are men. When someone arrives at a hospital with suspected alcohol poisoning, healthcare providers act quickly. They'll diagnose it based on the physical signs and what they know about the person's alcohol consumption. They'll likely run a few tests, like a breathalyzer or a blood test, to check the BAC, as well as tests to check liver function and electrolytes. Treatment is focused on supporting the body's vital functions while the liver works to process the alcohol. This often involves giving intravenous, IV fluids, to treat dehydration and stabilize blood sugar. They'll provide oxygen therapy, and if the person can't breathe on their own, they may need to be intubated, which means a tube is placed in their windpipe to help them breathe. In some cases, they might pump the stomach to remove any unabsorbed alcohol. If the kidneys are failing, a process called dialysis might be needed to filter the alcohol directly from the blood. It's crucial to understand that there is no home remedy for alcohol poisoning. Things like cold showers, coffee, or walking it off are myths and can actually be dangerous. The only safe place for someone with alcohol poisoning is in a medical facility. The potential complications are severe and can be long-lasting. Someone who overdoses on alcohol can experience blackouts, amnesia, and even permanent brain damage. The severe vomiting can lead to dehydration and seizures. It can also cause dangerously low blood sugar, which can also trigger seizures. The heart can develop irregular rhythms, and there's a risk of acute liver failure. The most immediate dangers are choking, falling into a coma, or dying. So how can we prevent this from ever happening? The most obvious answer is to drink in moderation, or not at all. If you do choose to drink, be mindful, pace yourself. A good rule of thumb is to have no more than 1 standard drink per hour, and make sure to drink water in between alcoholic beverages to stay hydrated. Never ever participate in drinking games that pressure you to drink quickly, and always eat a meal before you start drinking. Don't drink on an empty stomach. Be wary of mixed drinks where you don't know the alcohol content. Finally, never ever mix alcohol with medications. If you or someone you know struggles with alcohol or might have an alcohol use disorder, please know that help is available. There is no shame in reaching out. Talk to a doctor, a therapist, or a trusted friend. There are resources and support systems that can guide you toward a healthier path. Thank you so much for watching this important video. If you found it helpful, please give it a thumbs up and share it with people you care about. It might just save a life. Don't forget to subscribe for more content that matters. Stay safe and look out for one another.